a lot further. Less pinchy.
Yep. I have to try not to swear if you're going to use this content.
Well, I'm sure it's nothing people haven't heard. So bring the knees all the way up, straighten that leg on there. If it's too much, you let me know, but it's not going to be comfortable. Okay. Pull into the belt. So pull, pull. So it's this hip?
Yep.
Okay.
And use acupuncture on that side.
On that side?
Yeah.
Okay. Are you getting any pinching there?
Yeah.
On the inside?
Right here.
And then if I come down, you still get that, or?
Worse.
Worse, okay. And then, any pinching there?
No.
Okay, that side's pretty good. I'm just gonna keep the legs straight. If you're uncomfortable with anything, just let me know.
Okay.
Just tight?
Yeah, I mean, he just worked on my leg a little bit too, so I'm probably a little bit more loose than I usually am. But
That side's a little bit more bound.
yeah, it's very tight.
Okay. Lay on your side, face that wall. And if I go here and just relax that leg, this is what we had some issues with last time. Yeah. Any pain, discomfort there though?
Not really.
Let me see what the other side's like. And just relax that leg. Good. See, this one just drops a little bit easier.
Yep.
It's actually not as bad as last time, that one. Lay on your stomach there for me. Knees together. Drop the feet out to the side. Good. Yeah, so tighter on that side.
Yeah.
Okay.
I don't know what it is about this side of my body.
All right, lay on your back again. Test a little strength test. So if I go here, don't let me move you. I'm going to push you towards the door. Ready, go. Strength's good.
Thank you.
And then this way, don't let me move you. Ready, go. Way better than in the past. So that's good. Yeah, that's moving all right. This one's tighter, but that's the foot, right? That's the one that you're kind of getting like the Morton's neuroma type symptoms. Okay, so we'll work on this. All right, so lay on your side, face that wall. Scoot back a little tiny bit.
Do you?
Yep. Good. All right, I'm gonna work all along that sacrum. So you're gonna be here. Yeah.
You're gonna hear this in your microphone, my belt down.
Bring this knee up towards your chest and then straighten that leg out. Yeah, fight for every inch. Pull those toes towards me. Good. And then come all the way back. Yeah, so I'm gonna pin it in that short position.
I have to try not to swear if you're gonna use this content.
Well, I'm sure it's nothing people haven't heard. So bring the knees all the way up, straighten that leg out, pull the toes towards me. Good. Perfect. And come back. Just think about how much better it's going to be afterwards. And then again. Good. Perfect. Pull the toes towards me. Good. And come back.
Okay, wait. I can't even breathe.
Has your running volume been pretty high lately?
It's lower now than it was all season.
Yeah.
So I was averaging about 45
back.
kilometers a week at least, 45, 50.
Yeah.
Leading up to the ultra marathon that we did, and then I didn't actually do the ultra distance. I should note. But it was high then, and now that it's just higher up season, my long run is still like, I try to get like 15 on my long.
Yep.
And then one interval workout, sometimes two, and then just more like tempo stuff. So I'm not running as much, but my intensity is much higher.
Okay. Intensity is higher, volume's lower.
Intensity is higher, volume's lower, yeah.
Pull the toes towards me, good. And then come all the way back. What was the ultra marathon? Was that like a last man standing kind of thing? Or?
That one was very similar to the setup that I'm doing with the backyard movement. I'm trying to move, but my brain literally won't let me. It was 24 hours.
Okay.
And it was just a looped course, and as much as or as little as you could do.
Right.
And
come back.
It's hard for me because I can't eat.
Yeah.
So I'm basically, as soon as I eat, I'm done. So I only got like 35 in, and then I was done.
And for like an ultra, you just got to be constantly just feeding.
Yes. Like Steve was literally like eating bowls of cereal between laps.
Yeah.
And chocolate milk. And as soon as I eat, I'm done. So.
Have you watched like the BPN Last Man Standing?
Yes.
So like it's seen, and they're coming out with the documentary soon too, right? So it's going to be interesting. But yeah, like, and it ended because of like a thunderstorm, which is crazy. Like,
yeah. People are wild. Like just going to one of those events and like speaking.
And then I'm coming into the back. Okay, so it's the exact same thing. Yep, and again.
Bending up?
Yep, all the way up, the exact same. Good.
Seeing like the kilometers, like even the one that we did, like people went for 36 hours and like some guys like never slept, never sat down.
Yeah.
You found the spot that hurts.
Good, and then come back. And then just a little higher. Yep, last one.
I just like ultras because they're chill.
Yeah.
There's like zero pressure.
All right, lay on your back there. I have a couple clients that have done ultras, and they're like, yeah, I did this, and I'm like, man, like that's amazing. And they just like, oh, it wasn't that great. And I'm like, what are you talking about? Like, that's crazy. Still pinching a little bit.
Yeah. Steve did 100 and.
All right, so you're gonna lay on your side, facing this way.
My side this way. Our friend Kathy, she did 104.
Slide all the way back. 104 kilometers.
Yeah.
Yep.
And
bring this inside knee up, and then this leg straight back. Good.
Our other.
Come back a little bit further. I'm going to stabilize you. Yep, that's good. I'm just going to make sure you don't fall off.
And I think Steve did like 75 or 80, something like that.
It's crazy.
I definitely came in very much last between that friend group.
Yeah. Do you feel stretch there?
Yeah.
Any pinching?
Mm-hmm.
A little bit of pinching?
Yeah.
If I come down and then up?
No, none.
Just
That's also less of a stretch.
Okay. But more of a stretch there now?
Yeah, but very targeted into the groin.
Yeah, I don't want that.
Where do you want it?
I want it on the outside of that hip.
Okay, then maybe come up closer to my chest again like you were. Yeah, there. But it also goes to my groin.
Yeah, so I don't want that. Okay, so lay on your back. I'll have to do a different technique. We need some towels.
Uh-oh.
Okay, so we're just gonna bring this knee up. Good. I'm just gonna place some towels around here so this isn't just driving into your leg.
Sure.
So we're just gonna have to do a little bit of distraction of the hip, just because with the normal techniques, you're still getting some pinching. So basically I just wanna take that hip and kind of pull it, give it a little bit more space outside the socket to move without getting that pinching.
I feel like they did this when I was pregnant. Something similar.
So lift the foot up there. So this is, it's called like Mulligan's technique. Good. So we want to get that as close as we can to the hip. And then I usually just start with the foot down, and then you should just feel like you're probably going to feel the groin because it's going to be tight. You're going to feel the belt kind of digging in a bit, but you should feel a little bit of a stretch on the outside of the hip eventually.
Okay, yeah, I don't yet.
Okay, pull into the belt. So pull. 3, 2, 1, and relax. Good. Sometimes you just gotta get to relax a little bit. Okay, gently push out into me. Yeah. And relax. Good. And then pull into the belt.
Pull into the belt.
Yep. And relax. Good. And you might not feel, as long as you don't feel like too much pinching in the hip or anything like that.
Yeah, I'm not really feeling that pinching in the hip at all.
Yeah, good. Good. And then I'll come up here. I'm gonna push the hip to the back of the socket, and then I'm gonna give a little tiny pull. And then, no pinching there?
No.
Because like if the belt wasn't there, this is the position that you would get that pinching.
Oh, okay.
Right? But the belt's just kind of like tractioning, or what we call distracting the hip.
Yeah, I don't feel like any of the burning.
Yep. And then I'm just gonna come across. 2, 3, 4, 5, 12, 13, 14. And then pull into the belt and relax. Good. Good. Lift your foot there. Perfect.
Megan did pretty good at the CrossFit Games. Holy cow.
Yeah, that's pretty amazing.
Pretty impressive, right?
That's better. I can get you further before I feel that pinching. Okay, so let's try that technique again. So you're gonna lay on your side, face that wall. Yeah, bring that leg here, bring that knee up a little bit, and right there is good. So I'm just gonna give it a little push to the back.
Good?
No pinching this time?
No.
Okay. So I just had to kind of open up that hip a little bit.
Yeah.
I wouldn't want to go any higher than this because I think you'd feel it, but it should just be like a deep stretch on the back of that hip now.
Yeah, now it is.
Yeah. Whereas before we were just kind of running into the front of the hip.
Yeah.
Good. I'm just going to bring this foot up a little bit. Perfect.
I wonder if it's like something with my running.
Like stride?
Yeah. Because if you look at the bottom of my shoes, the wear is way worse on the side. And when I had my epidural from Sophia, this foot catches. Like I've fallen like 3 or 4 times this year on the trails, especially because I've caught this toe has not come up.
So almost like scuffing.
Yeah, like, and if you hear me run on pavement.
All right, so now I'm going to just release piriformis. So only muscle that kind of crosses that
I'm really not looking forward to this.
SI joint. So just coming on there. If it's too much, you let me know, but it's not going to be comfortable.
It's actually not bad.
It's usually not as bad if I get the hip moving better first. But if I would have started with this, it would have been a lot worse.
I actually hardly feel it, if I'm being honest.
Because you got to think like all the muscles, they attach onto the bones. So if you get the pelvis into a better position, you give the muscle a little bit of slack, right?
Yeah.
It's just like if you were super anterior pelvic tilted, your hamstrings might feel tight all the time, but they're actually on length all the time because it attaches onto the back of your pelvis. So if your pelvis is dipped forward, basically that hamstring is going to feel tight all the time, but it's actually that's because the pelvis is in a anterior tilt. And some of that is all right as long as you can control it in the other direction. So like, for example, if you look at like a Conor McGregor, like you look at him and you'd be like, oh, he has like really bad posture because he walks around like this, right? But when you tell him to go in the back another way, he can do that, no problem. But this is an actual advantage to him because he has more reach when he punches, right? So like for him to walk, this is why he's like that. You wouldn't want to fix that. But at the same time,
I'm not fighting.
But at the same time, if it's like somebody that sits at a desk, you ask them to go back another position, they can't. Right. That's the difference. Is Connor can control it, they can't. Yeah. Right. Same with Simone Biles. Like if you watch her stand, it's the exact same thing as you. Right. The hyperextended, super anterior pelvic tilt. Right. But then you ask her to do like a backflip or something, she can completely go back into that other range. Right. Right. So it's more important that you can control it. Right? Yeah. If you can't get out of that position, then you're in trouble. Right. So like sometimes people worry about that a little too much.
I do because it looks bad.
Yeah.
Like my shoulders are hunched, my pelvis is forward. It looks like I got a beer gut.
Yeah.
Maybe I do, but I don't drink beer, so.
Yeah. No, but then that's the thing, right? Is you post your pelvic tilt, and you you soften your knees, and all of a sudden you look skinnier, right?
Because it's like look thinner.
Yeah. It doesn't look like you have a beer gut anymore. That's way better.
Yes, it is. You can hear it.
All right, you can move back to the bed, middle of the bed there now. Lay on your back. I'll retest again. Yeah. A lot further. Less pinchy.
Yep.
Good. And then less jammed.